Welcome back to the Rethink It podcast, the Brain Health and Longevity podcast. This podcast is for those of you struggling with brain health issues and for those looking to protect your brain in the future. In this podcast, I encourage you guys to learn to be a good steward of your health. A steward is someone who cares for something that doesn't belong to them. I'm sure that you guys are going, wait a minute, my health is my own, my body is my own. But here's the thing. I believe that the body is a gift from a loving God and that we are granted the opportunity to care for it as an act of worship in our everyday life. I believe that our health is a gift as much as any other resource that we are granted in this life. Most people try not to be frivolous with their monetary resources, their time resources, or their relationship resources. I believe that our health is one of those precious resources we are called to intentionally care for during our time here on Earth. So in this podcast, I hope to give you practical, scientific, cost-effective tools to empower you to good health stewardship. Dementia rates are skyrocketing and at younger and younger ages. You guys, 35. It's outrageous. My hope is that you are able to use the information in this podcast to prevent dementia and to reverse course if you have it. It is possible. I believe the body is created with an innate intelligence given by our Creator, and because of this, it is possible to heal from even the most difficult challenges when we address the root cause and in the right order. So when we learn to use the right tools to care for our body, you can be your own best doctor. There is really hope for lasting healing. Welcome back to the Rethink It podcast, you guys. I am so excited for you guys to be here. I just finished recording with our next guest, and I'm going to give you some of the highlights of that here in this little prelude. But you're going to get to hear from another PA, because PAs rock. I like to gently coin us physician assistants, PAs, as patient advocates, because that's what we do, right? We are going to spend more time with you. We love patients. We have a different perspective, not wrong, not better, but just different than just your standard physician. So I'm excited to bring you another PA onto this podcast. Danielle is a certified physician assistant, and she is the visionary founder of NavWell RX. She has about 2 decades of clinical experience and is a leader in the field of integrative medicine. She specializes in psychoneuroendocrine immunology, PNEI. Okay, and she is harnessing that power of PNEI and osteopathic manual therapy to explore the intricate connections between the nervous system, the endocrine system, and the immune system. It's very important. This is understated. Like, this is a very important connection. We are not just the immune system. We are not just the nervous system. We're not just the endocrine system. All of these organ systems are interconnected, and they are important to address all at once. So Danielle does like to dive deep into the underlying causes of health issues ranging from chronic fatigue and autoimmune conditions, and she has a global initiative for women's health, providing research and education to support women with breast implants, and that's what we're talking about today. Okay, her journey into functional medicine began in 2015, and since 2017, she has dedicated herself as both a practitioner and an advocate for breast implant illness. Drawing from her professional and personal experience, Danielle has meticulously crafted a structured approach for both optimizing health pre and post explant. Danielle's core belief is in the body's interconnectedness. That's why she's on this podcast, you guys. And how important it is to generating lasting healing. That's why I tell you guys there is hope for lasting healing. She goes beyond just addressing symptoms and focuses on uncovering and addressing the underlying issues. So you hear why I chose to bring Danielle on today, because she is definitely a fellow root cause practitioner and fellow PA, and I am just excited for you guys to hear this conversation. In this episode, we will, of course, be talking about breast implant illness, which, thank goodness, has gotten a lot of press recently. As many of you know, I personally struggled with breast implant illness, and this is why I think it's so important to talk about it with you today. And if you aren't familiar with the idea that breast implants cause brain health issues, believe me, it's okay. You're not alone. I was well into working as a holistic integrative practitioner before I really understood just how bad implants were and had mine removed. So I'm not, no judgment at all coming from me. I mean, I knew at the time that they couldn't be good for me. I already kind of had a plan to get them out. But I just didn't fully appreciate the significant impact that they were having on my brain. And that's just the thing, isn't it? When the brain is the organ injured, it impacts our ability to think clearly and to perceive clearly and even to regulate our emotions well. I was very lucky to meet Danielle at a conference where she was lecturing on this topic. And while I was in the middle of planning to have my implants removed, so I was already planning, looking for surgeons, trying to figure out how to find a surgeon that was not going to, give me grief for wanting to take them out or not, I don't know, not, validate that I was having issues with them. So needless to say, my mind was really blown when presented with the data that Danielle presented on breast implants. So Danielle's work to connect professionals on this topic was super instrumental to help me locate a plastic surgeon who was familiar with BII and specifically with explant surgery. I mean, yes, every surgeon can explant. That doesn't mean every surgeon should explant. We want somebody familiar with BII and certain things to make sure that we have somebody explanting with that in mind. So I am beyond excited to let you hear from Danielle today. And without further ado, let's dive in, okay? Welcome back to the Rethink It podcast, Danielle. Well, welcome back to my audience. Welcome to you. I'm so glad you're here.
I'm so glad to be here.
We've had a morning trying to figure out this technology. So thank you for being patient with me. In the intro, I talked about your professional approach a little bit based on some of the information I had. And I also talked about how we met. And we touched a little bit on breast implant illness, but I would really love for you to share your story. So how did you go from being a traditional Western PA to an integrative practitioner who focuses a lot on breast implant illness?
Yeah. Well, let's see. In this October, it'll be 7 years explanted, right?
7 years explanted. So that means that you were a BII patient.
The what? For sure.
Yeah.
For sure. Yeah. And when I was 48, I lost about 40 pounds. I was so stoked. Had a 6-pack at 48. Come on. Hopefully people are going like, damn, that's awesome.
Dang, girl. That is awesome.
Well, no, it was so good to be perimenopause and feel strong.
Right.
To be able to do the things. And
oh my gosh,
I felt like I had a new lease on life.
Yeah.
Loved the burpees. I know people are like, oh,
no, I love burpees. Yeah.
No, because I couldn't do it before, and then I could, and life was wonderful.
Yeah.
And when you lose that much, and in perimenopause, the skin is different.
Yep.
And so I didn't have any chest, and I thought, well, you look at all the sports figures and the different things, everyone had them, and I'm like, oh, I think it's time for me to get them.
Yeah.
So I did my investigation. Now, I interviewed plastic surgeons and decided to go with one, and they said, oh yeah, implants are probably what's going to achieve your goals the most. So I went in and I had breast implants done. Never did I hear anything about, do you have an autoimmune condition? Yes, I did.
Oh, really?
Yeah. No one ever, there was no informed consent back then, because that was probably 9 years ago now, roughly.
Yeah.
And so long story short, I got them in, and 3 months later, my ankle, I wish I should have brought pictures, but my ankles you couldn't see my ankles. They were
just send them to me. I'll upload them on the
Oh,
YouTube.
sure.
Yeah.
The swollen, excited about that.
So exciting.
No, but things happened. And now how I found out my autoimmune condition, Graves' disease, was I had like swollen limbs and my ankles were swollen, but not this swollen. And
Mm-hmm.
I hadn't seen that in like 20 years. So I was like, this is
Wow.
just strange. So
Wow.
during this time, I'm studying with the Institute of Functional Medicine, IFM, and they're teaching us to go over patient histories in a different way, a
Mm-hmm.
deeper way than as in PA school, right?
Right.
And I'm like, huh. This started when I had breast implants. So I thought, okay, maybe it's surgery related because it's only been three months. And
Legitimate thought.
yeah,
Surgery is a
well, and
high
who wants to
high
think it
stressor.
is? I'm sorry, say
Anesthesia.
it again.
That surgery is a high stressor. Anesthesia's high stress.
Yeah.
Absolutely. Yeah. So legitimate thinking.
And
Yeah.
it can't be anything I did to myself.
That could be the implants.
You know? No, I
Implants are
actually,
safe and
it
effective.
never crossed my mind in that way.
Of
Um,
course.
Hair loss. It took a while for the anxiety to show up. The
Mm.
anxiety got exacerbated when you'd go to physician and
Oh
say, "Why
yeah.
is my neck hurting? Why are my
Mm-hmm.
hands numb? Why
Mm-hmm.
am I so swollen?
Mm-hmm.
Why am I bloated all the time? Like this,
Right.
you know, 6 months ago, that was not even in the picture. I've done nothing different other than get breast implants."
Right.
So I would ask the plastic surgeon, "Do you think it's my breast implants?"
Mm-hmm.
And you'd run your fingers through your hair, and the hair would be falling out and different things like that. The adult acne at
Oh gosh.
48, 49, not
Holy cow.
attractive.
Wow. Yeah.
I'm
Yeah.
trying to remember,
All
like,
these like xenoestrogen point markers,
yeah,
inflammatory markers that are kind of, yeah.
and you look at it as like at 48, it's perimenopause.
Yeah.
It has nothing to do with the
Sure.
surgery. It has nothing to do.
Is that
I'm
what
like,
you also heard from your doctors? Is that what they
oh
were kind of,
yeah,
yeah.
yeah. I'm like, okay, so let's go on bioidentical hormones. Let's go do these things. And I had like
Wow.
ovarian cysts. I had,
Oh my gosh.
um, right around that time, we were studying estrogen dominance and what could cause that. And that's when I was like, xenoestrogens,
Mm-hmm.
endocrine
Mm-hmm.
disruptors. Can I
Endocrine
cuss on this
disruptors.
podcast or?
Yeah. Yeah.
Because I was like, oh shit,
Yeah.
where's my breast implants? Like
Yep.
literally. But I would
Yep.
still go for validation,
Yep.
the orthopedic, because I really had bad cervical pain, and so much
Yep.
so that the only way to be able to get through the day was to stay like this, right?
Holy moly.
And
Yeah.
that's an orthopedic sign. I just can't remember what that was. And they're like,
Yeah.
you need fusion of your cervical spine, and I'm like, no, that it just felt so blown out of
Right.
proportion. And then I really struggled with them telling me it's not the implants. It's not that at that time I really thought it was,
Yeah. Yeah. Yeah.
but the fact that it was just totally dismissed.
Right. Right.
And
Right.
I was having so many structural issues.
Mm-hmm.
I just thought structural.
Yeah. Sure.
Pain,
Sure.
structural, swelling,
Neck.
structural.
Right. Yeah.
Um,
Neck pain. Gosh, that was part of I had neck pain almost my entire life, really bad. And then even before I had implants, I remember being a teenager and having neck pain, like
oh
a
yeah.
lot of neck pain. But I had started having peripheral neuropathy, which I never ever attributed to the implants at all. Like I didn't realize I actually had carpal tunnel surgery because I was working as an orthopedic spinal surgery PA, and I would be dropping instruments. I couldn't, I didn't,
You can't.
I couldn't help it as long as I was trying to drop it where it was clumsy. It was just because I couldn't, like all of a sudden my nerves just failed. And I thought, oh, it's carpal tunnel. I had carpal tunnel surgery. And I mean, just this peripheral neuropathy going down my neck at 28 years old or whatnot, which did improve. I did go see chiropractic care, and it was the first time in my entire life that I didn't actually have the like really bad neck pain. I just thought neck pain was something everybody always had because I had it so long. But it
Did
got
you
so
have
much
breast
worse
implants then?
at 28 when I was dropping all the instruments. Yeah, I had implants. I
Ah.
had it before, but it got way worse when I had them. Now thinking back on that,
Well, and
you
then
know,
you think now, in hindsight, it's like, oh, the brachial plexus, oh, thoracic inlet, outlet, however you want to call it. Like, and you
yes,
just think of like, oh, why wouldn't I have rounded shoulders or more exacerbated rounded shoulders?
sure.
When you're in surgery, You're just
Y-
holding your body
Yeah.
the best way to serve
Yeah.
the orthopedic, right? So,
Right. Right.
or the surgeon.
Exactly. Or the surgeon. Exactly.
Oh,
So it's easy to miss that and easy
yeah.
to
No,
feel
and I
like,
missed it too. Two PAs missed it.
yeah.
I was like, wait.
Yeah.
And you go through nerve conduction studies and you do all the things because all the
Yeah.
physicians are your friends and they all want to help
Right.
you. And they're just like,
Yeah.
I just think this is, what menopause is going to be like for you. And I was just like,
Oh, oh
this,
my gosh.
it just was so,
So
it
that's
just
where the
was not
anxiety started,
acceptable.
right? Is that where the anxiety started when you heard
Yeah.
that? Well, this is
Yeah.
just menopause for you.
Well,
I
if
mean,
this
not
was,
laughing here, but this is, I
no,
can
but if
see
this was
that.
going to be life,
Mm-hmm.
what the hell?
Yeah.
you know?
Yeah. Right.
Um,
Yeah.
and so innately, I wasn't, at that point, I didn't know anything about BII.
Mm-hmm.
And so I just decided to remove them because it was, what do you call it? Paradoxical. It's like implants, 3 months later, boom. Like
Yeah.
there was nothing else. Life was awesome.
Yeah.
Like
Peak
there
of
was
your physical performance,
like everything really was
doing
like
burpees, had a six
flying
pack.
burpees.
Yeah. Oh
And
my gosh.
so luckily the plastic surgeon who also didn't believe it was the implants was like, let's just take them out. If
Yeah.
you don't get better, we'll put another set in. If you get better, then we're like, huh, right? All
Right.
the while in hindsight, I know he knew something
Yeah.
about breast implant illness and stuff, but
Yeah.
he didn't expose that to me.
Wow.
And so, and right before I went in for surgery, my guy colleague says, and now get this. So I worked as a class 3 medical device, which breast implants are now a class 3 medical device. So when
What does
I
that
get
mean? Sorry.
it is I helped companies get their devices approved through the FDA. So you have to
Oh,
do
okay.
preclinical, clinical work for years before
Mm-hmm.
your device is like approved or considered safe.
Mm-hmm.
So I just
Okay.
assumed I do this for a living.
Mm-hmm.
This is, and breast implants are a class 3 medical device. Someone like me did this with them.
Mm-hmm.
No,
Mm-hmm.
well, that's another story. But
Yeah.
so I was like falsely believing inadequate testing,
Uh-huh.
preclinical and clinical testing, and
Uh-huh.
over the 7 years, I realized that wasn't the case. But
Uh-huh.
going in with that assumption that breast implants are safe and there's
Right.
no issues with them, I have
Mm-hmm.
another colleague who does the same thing, and he says, "I think you have Playboy bunny disease." And I was
What is
just like,
that?
"Yeah, exactly." I'm like,
Oh, I'm not
um,
sure I'm supposed to be offended by that.
well, no, but like Crystal Hefner had just come out saying she explanted because she had all these
Oh, I do remember
disease
reading
issues.
that.
So
Yeah, yeah.
where if she's ever listening, just thank you
For
for sharing because like that, indirectly or directly made me take
right.
out my capsule
Oh,
at that
wow.
explant.
Oh,
And
wow.
and so that was maybe a year and 8 months later after it took me that long to come to terms with having to explant or was it the implants and going in I
Mm-hmm.
still didn't know. And if that
Wow.
isn't enough to cause stress and anxiety, I
Yeah.
don't know what is. So anyone who's listening who has gone through that journey,
Mm-hmm.
how courageous are you for doing that? And
Yeah.
I hope you've had improved results, right? And
Yeah.
hopefully we'll have time to talk about how you can, if you're still having symptoms, how you can improve on that
Oh,
later
for
as
sure.
well.
Yeah. 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 Yeah.
But so they removed it. And as soon as I woke up, no numbness, no
Isn't that
pain.
crazy?
As soon as I could, see my feet, no
Yeah.
ankle swelling. The
Holy
hair
moly.
loss took a little bit, I guess, because of the anesthesia and
Yeah.
stuff. But
Yeah. Yeah.
the acne was gone within like 7 days. Something
Holy
crazy.
smoke.
Yeah.
Oh
And
my gosh.
I did not have like a complete resolution, but I had enough of one that I was like,
That
it was,
sounds pretty drastic. Like
yeah.
that's pretty, yeah, unequivocal.
And I asked them to test my metals, and I meant in the capsule, but
Mm-hmm.
they did a urine test, and my arsenic was off the charts enough that they kind of have to report it.
Holy
And
moly.
when I came to see the physician, the surgeon for my follow up, and he's like, "I just want to show you your arsenic results."
Oh my
They are
gosh.
off the charts. And he joked, we both joked, like, is anyone trying to kill you? And I'm like, well, maybe, you know?
Yeah.
And then they
Wow.
took out, and I said, let's do another test now that these are out. So we did another test and they were normal levels, right? And so I don't know if people read the literature, but people say it's our diet and rice. At that time, I was not eating rice, and
Yeah.
I'm pretty, I was living the life as strict as possible because I didn't know what was causing my issues,
Right.
right?
Right. 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 Right.
So methylation was clearly disrupted,
Mm-hmm. Mm-hmm.
and of the metals that tested, arsenic was like the highest one. And
That's so
so
crazy.
what I want to say about that is that while there are chemicals and metals in the breast implants used to cross-link the
Mm-hmm.
silicone, used in manufacturing for different reasons,
Mm-hmm.
there I don't know that there's enough arsenic in a breast implant to make my levels that high.
Mm-hmm.
What breast implants do is interrupt and disrupt our ability to methylate
Mm-hmm.
all the things coming into our body,
Yes.
right?
Exactly.
So one
Mm-hmm.
of my passions is to make sure people are aware that it's a methylation disruption, not
Absolutely.
necessarily we talk about the metals, you hear everyone going like, oh, I got to go get my
Mm-hmm.
capsules tested for metals and the
And
breast
that's
implant
why
for metals.
that's why we don't just do chelation therapy or something like just do all these detoxes to bind or capture the
Uh,
metals, because the problem isn't just the exposure to the metals, it's the problem of the cellular detoxification pathway, which is what we're saying when we say methylation, just so those who are listening don't know what that is.
yeah,
Methylation is just something that happens in that cellular process, and there's different, a lot, the most common methylation pathway people hear about and know about maybe is MTHFR, but there's 9 or
so
10 or
many
different,
more.
different pathways, and they affect different areas of the body, the brain, and things like that. So yes,
Yeah.
so important. Mm-hmm.
And so as soon as they were removed and I took what I remember to be my first breath, I was just like, oh, it was the implants.
Mm-hmm.
And at that point I just shifted my study, my focus, to understand more about what do we do about it and why. And
Mm-hmm.
then 3 years later, I had a mammogram
Mm-hmm.
that showed I had a seroma in my left breast.
Mm.
And in hindsight, they had removed the left drain quite early,
Mm-hmm.
and the right one like almost a week and a half later. And
Mm-hmm. Mm-hmm.
so I think that the drain just was removed too early. And I
Mm-hmm.
had at that time I had a seroma that they aspirated and did things. So
Mm-hmm. Mm-hmm.
when they found it 3 years later,
Mm-hmm.
I I I was actually preparing to get a fat transfer because the left breast was so much bigger than the right breast, just to even
Mm.
it out. But it turns out it
It
was
was
that
the
I had a
seroma.
decent sized seroma
Oh
that
my
now
goodness.
had a capsule around it, pretty
Oh my
thick
gosh.
capsule. So it's now like this bursa thing.
Yeah, 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 yeah.
And if I wasn't already hook, line, and sinker to research BII and breast implants, on explant, they took out that capsule,
Uh-huh.
still not thinking anything. But 3 months later, I was like, wow, like, well, I just felt lighter. Life was
Mm-hmm.
easier. Like I
Mm-hmm.
didn't feel as heavy.
Mm-hmm.
And I called the pathologist because I was doing a report on my first
Mm-hmm.
explant. And I
Mm-hmm.
asked him, I said, did you find silicone in the capsule? And he goes,
Mm-hmm.
oh, absolutely. And then he said something that made me ask, what's the date of the report you're looking at? And it was the one from the seroma.
Oh my
And so
gosh.
he found silicone in the seroma post complete
3 years
capsulectomy.
later.
Yeah.
Oh my gosh.
So
Wow.
that
That,
made me
yeah.
study more. Like,
Oh my
okay, so I
gosh.
had a complete capsulectomy,
Yep.
or did I?
Yeah.
And
Exactly.
so I trust my plastic surgeon. So
Yeah.
he removed everything he saw,
Sure.
um, and could get, and there was more silicone within a bursa of a seroma. right?
Incredible. That's
And
incredible.
and so,
Three and only 3 months in implants. Not like you had them like I did for 20 years.
right. Yeah. And then 3 years later, I'm still having silicone that my body's responding to.
That's
Right.
incredible.
Um, so
Wow.
yeah, but all the while I felt improvement. There was just always like a ceiling on that improvement,
Mm-hmm.
but I was so
Mm-hmm.
happy to not feel like death
Yeah.
that like I wasn't complaining.
Right, right, right.
And what I know now, oh my goodness, like the
Mm-hmm.
I feel like I'm still learning, and I feel like
Sure.
even at 57,
Mm-hmm.
like the ceiling keeps getting higher so I don't hit it,
Sure.
right?
Yeah, yeah, yeah. That's because you
Um,
feel better and better each year.
yeah,
How many people can say as they go through perimenopause after 50 that each year they feel a little bit better?
right. Well, maybe it
That's a
has
kind of
something
a
to do
huge
with now
thing.
I'm postmenopausal now.
Aha. Yeah.
Right. And I do use bioidentical hormones, and
Uh-huh.
I do what I call some biohacking as well.
Mm-hmm.
And
Sure.
I like some peptides and different things. But
Yeah.
um yeah, life is good. And
Yeah.
anyone who is considering and not sure, like there's different things you can look for to see if it's your breast implants. But even if we see those things on imaging,
Mm-hmm.
it's a diagnosis of exclusion. So
Meaning that
um,
we have to rule everything else out before
yeah,
we can. Yeah.
how I look at it though, because even if you have an autoimmune issue,
Mm-hmm.
that doesn't mean it's not the implants causing it. So
Uh-huh.
how I look at diagnosis of exclusion for this population is
Mm-hmm.
you got to
Yeah.
explant, and for me it's explant plus the capsule, the whole
Yes.
capsule,
Yes. I
and
agree with
then
that.
see how you feel. If you
Yeah.
improve, there's your diagnosis of
Mm-hmm.
exclusion. Like
Mm-hmm.
I don't buy I know we don't have the ICD-11 code and different things like that, but
Mm-hmm.
that's my version of diagnosis of exclusion. When you
Mm-hmm.
have the studies like ASERF study, that was like Glicksman, McGuire, Adams, I think. I
Mm-hmm.
might have left somebody out. They looked at a population that didn't have BII but had breast implants,
Mm-hmm.
and then they had BII with breast implants,
Mm-hmm.
and both groups reported health improvement after explant. There's
Hmm.
a Dr. Diva in Australia. He reported the same thing,
Mm-hmm.
right? So
Mm-hmm.
I say, if when in doubt, explant. Not
Yeah.
that everyone has all the money, and surgery is a risk, right?
Yes.
So you got to
Mm-hmm.
talk about that with your physician. So I'm not
Mm-hmm.
just like,
Yeah.
pushing it
Right.
on,
Right. Right.
but that is the way to know if you have it.
Right.
Um, Now,
Right.
that said, not everyone gets better.
Mm-hmm.
Not everyone gets all better. Some people
Mm-hmm.
get some better, and
Mm-hmm.
some people don't. And there's
Mm-hmm.
concomitant things that happen when we're immune vulnerable,
Yeah.
from Lyme to
100%.
mold to different things.
Exactly. The biofilms are more complex once you've integrated some of the um, silicone into your body.
Yeah. Well, it
Yeah.
just houses, it creates a wonderful moist environment. I hate that word, by the way,
Yeah. Yeah.
but it creates an environment in which things can grow. And then
Yeah.
some of these proteins that get made, and you can make it, they were looking at BIALCL and how it can change the genes, like the STAT3. And we don't need to get into all of that, but like
Mm-hmm.
they're really looking
The
heavy.
oncogenes, the genes that control cancer regulation.
Yeah. So if
Yeah.
it can do that in some, what is it doing in others?
Right.
Right. So just
Right.
to get a little heady, right?
Mm-hmm.
There's a wonderful radiology oncology physician in Sao Paulo, Brazil, named Eduardo Flore.
Mm-hmm.
And he looked at women. He started out studying BIALCL, and he noticed within the breast implant,
BIIALCL. I'm just
BIA, so
BIA
breast implant associated anaplastic large cell
cart
lymphoma.
lymphoma. So it's a lymphoma specifically linked to breast implants. Just so the audience is clear on,
Yeah.
on
Thank
what we're
you.
talking about. We're doing these quick, short little like BII breast implant. Whatnot. Everybody knows the anacronyms or whatever those are called. Those little
Yeah. And
abbreviations we like to use.
I get so
So
geeky, I
she
forget.
just rolls them off her tongue because it's what she does every day.
So
So
here's a
he was
few more, but
studying.
I'll try to
That's
define it.
okay.
He looked through CT scan, and he sees this granuloma, this little tumor that is in every BIA-ALCL patient.
Mm-hmm.
Then he looks at just the BII population,
Mm-hmm.
and he finds this little granuloma, this
Mm-hmm.
growth due to something like inflammation. And he dissects it and he looks at it. There's silicone in this little granuloma that he identifies. And so that's called a silicone induced granuloma
Oh, wow.
within the breast implant capsule. So you have the implant and the capsule. So it's in between the space that it's not from the body.
Mm-hmm. So I'm going to get this really simple for people. So just like assuming you know nothing. So excuse me, people who do know some things, but just for the simplest terms, and if you've never looked at this, you have your breast implant that gets placed underneath, either underneath the muscle or underneath the breast tissue. And the body responds by making a scar-like tissue around it. And that's what when we say capsule, we're talking about this scarring-like tissue that develops around it in the same shape as your implant. And then in between that capsule and your implant is oftentimes sort of this fluid, this biological fluid that allows movement. So you have your implant, some fluid, this capsule, and then your normal anatomy, ideally, either your muscle or your breast tissue. Am I right?
Yeah.
So what you're saying is in that fluid around the capsule is where
Well,
they were finding this granuloma, or the actual capsule itself.
and sometimes there's not fluid there, it's adhered to
Right, that's true.
the implant, right? And
Right.
especially the textured ones, like
Mm-hmm.
it
I
is
had
like
that issue.
right up on there.
Yeah. Yeah.
Um, and it is that space that
It's a
makes you go,
theoretical
interesting,
space. Yeah.
because it's your body makes the capsule to protect you. This
Mm-hmm.
happens with any implantable device, right?
Mm-hmm. Mm-hmm.
It makes this barrier, and then you have the implant. So in a way, nothing should grow,
Mm-hmm.
but
Mm-hmm.
this is it's not this big. It's like,
Mm-hmm.
and
Yeah.
so he can identify it with his special way of looking at the CT scan, and
Mm-hmm.
um, imaging. He can do it with ultrasound as well.
Mm-hmm.
Um, and it's the silicone induced granuloma within that. So I
Mm-hmm.
know that if you have this, we know,
Mm-hmm.
then it is inflammation.
Mm-hmm.
And as integrative practitioners, we know that all we want to do is decrease your inflammatory
Respond.
cytokines and all this
Right.
kind of stuff, right?
Right. Mm-hmm.
Um, and how do we bring your inflammation down? Is we remove that, or we remove the
The
cause that is,
source. Mm-hmm.
yeah. And
Mm-hmm.
so this little thing that has silicone in it, um, certainly you have skincare products that could have silicone in them,
Sure.
right? And
Mm-hmm.
cookware and different things.
Mm-hmm.
But that would be odd for it to grow and collect within this right near the breast implant, which
Mm-hmm.
also is a massive silicone device.
Substance. Yeah. And
So when
even, would you say, even in the saline, because I get this question a lot, in
oh
the
yeah,
saline implants, we still have a silicone like
shell,
capsule gel, right?
yeah, you
So that's
still
not,
have, and
you're not
one
immune
of
to the silicone even if you have just saline
yeah, no,
implants.
the only the only way you get the saline implant is to
Through
be
ice.
housed in a silicone
Okay.
capsule, a
Capsule.
silicone shell,
Mm-hmm.
right?
Mm-hmm.
And
Right.
they have saline have their own
Risks.
risk and different issues,
Mm-hmm.
especially, well, I think now we breast implants make us immune vulnerable, and it changes our
Mm-hmm.
microbiome from head to toe,
100%. Yep.
which makes us mold vulnerable.
Yep.
Right. And
Right.
so that can be a whole different conversation. So, but
Yeah.
the good news is there is someone in Brazil, Dr.
Mm-hmm.
Flore, who can read your imaging and see if you have this inflammatory response.
That's
And what
amazing.
he found is when you take away that inflammatory response, a lot
Mm-hmm.
of people have symptom reduction,
Wow.
right?
Wow.
So you can't say that that is directly BII,
Mm-hmm.
but it's the closest objective sign that I have
Objective,
to
not
say,
just symptom syndrome. Like when you have a constellation of symptoms, we often call you have a syndrome. So BII would be a syndrome, right? I mean, just correct me if I'm wrong here, but most diagnosis patterns we have like symptoms that we call syndromes.
Yeah.
And they often don't have an objective marker we can point to, like this blood marker is way off or this blood marker is way off. It's a syndrome. Like I would say fibromyalgia would be that, right? We have
Yeah.
a constellation of symptoms, and therefore we diagnose fibromyalgia as that syndrome. And so this actually takes your BII from just the syndrome kind of picture to something where we can point to something
Like
more
something's
objective.
happening, right?
Yes. Mm-hmm.
And I find it interesting that both the lymphoma population and the
Mm-hmm.
BII population have this silicone-induced granuloma,
Mm-hmm.
right? So instead
Mm-hmm.
of waiting for this late stage seroma thing to happen for the lymphoma,
Mm-hmm.
maybe we can take a look at this and say, there's an inflammatory response. What can we do? What should we do? And so we
Mm-hmm.
need more studies around what do we do with it and how is it actually correlated. But in
Yeah.
my world, I use that to help discern how to coach and navigate people towards explant.
That's good. That's really good. I had a similar story to yours, but mine took a lot longer. And I already talked about the fact that you were the one that made me go, oh, this is bigger than I thought it was. Like, this is a problem. But before I met you, I had started to enter your 40s, and I'd started to gain weight where I'd never gained. Like, I ate and slept and did well, and all of a sudden I'm gaining weight. It didn't make any sense, and I felt puffy. So my son, going through Lyme disease, we bought an infrared sauna, and I bought it for him because he needed passive detox in every way I could get it. But I was
Yeah.
like, hey, I've got a sauna.
So did
I'm
you?
gonna get detoxed, right? So here I am with my 20-year-old implants, or 18 or whatever. I'm like, I'm getting in that sauna. I'm gonna start sweating off some of this weight. And my husband and I did together, and he lost like 15 pounds and felt great. And I felt worse afterwards. After a month,
Yeah.
I felt so much worse. I was like, and I think I gained 10 pounds. And I was like, what's going on? This does not
Well,
theoretically make sense.
yeah. I mean, so what's going on is like your methylation's disrupted,
Yep.
right? And so you're just recycling, and you can't release,
Right.
you
I'm
can't detox.
recycling toxins that I try to liberate with my infrared, which then are now biologically active and causing more inflammation. So where they might have been stored in happy little fat cells somewhere, now I've liberated these toxins to cause more oxidative stress everywhere. So,
Right.
you know,
And
yeah, it was terrible. And the worst thing is that my brain fog got like exponentially worse. I mean, I don't even remember bits and pieces of that year because I was like,
it
it was
it's
bad.
crazy. And there's there's always that question, should I detox, should I sauna with
Yeah.
implants in or not, right?
Mm-hmm. Mm-hmm. I get
Um,
that a lot.
I think for me, I think my stance is we have no data saying that it's safe.
Yeah.
And I think when we increase we there's no testing other than at body temperature,
Mm-hmm.
like
Mm-hmm.
what occurs for the gel bleed. We know at
Mm-hmm.
body temperature we have silicone leaving that shell,
Right.
right?
Uh-huh. Now
What
we increase the temperature.
to 130, 150, 170, whatever it
Yeah.
is, right?
Yeah.
And then you add exercise and push-ups
Mm-hmm.
and friction on top of that. Like we don't know what that does.
Right.
And so that doesn't necessarily mean don't do it.
Mm-hmm.
And you got to see how you feel. You've really got to
Yeah.
monitor yourself.
Yeah. But like when I finally did get my implants out, now I'd been dealing with brain fog, word finding. I mean, I'd been dealing with an emotional, like, just I felt like I was crazy. I was like emotionally unstable, angry, like out of the blue. Like, what is wrong with me? Am I losing my mind? Am I bipolar? Like, I really had these questions because it was like, I don't understand what's going on with
No,
my
and
emotions. There's no reason to act like this, you
right,
know?
and you can't get in front of it.
Yeah.
Which, and I know we both are PAs, and in PA school, we had to learn how to just turn ourselves off and get through
Mm-hmm.
med school. Like
Right.
you just did the thing,
Yeah.
and
Yeah.
that was not. I
Couldn't
could
do it.
not. have that process anymore. And it was just like
Yeah. What is
mind
wrong
blowing.
with me? Yeah.
Yeah.
Yeah, exactly. And I think that it was so dramatic. Like you said, you woke up and you knew your first breath, you felt different. I was still sedated and I knew my brain was functioning like it was firing
Yeah.
differently. I was shocked. I was like, this, I'm supposed to be sedated. I know what they gave me, but I feel more clear-headed than I have in 10 years.
Yeah.
This moment right now, while I'm still under the effects of anesthesia. It was impressive.
Yeah.
So because it's a brain health podcast, I really highlight this because it is such a subtle thing. And when your brain is the thing affected, that you perceive and regulates everything in your world, your thinking, your perception, your emotions, everything. When it's being affected, it's hard to figure out and even self-reflect what is going on.
Yeah.
you know
And so this might dovetail nicely into that. Like, I don't know when it was, maybe 6 weeks, maybe 3 months, but when I had my first flare,
mm-hmm.
right? And it felt like the glory days were then gone since explant. And
Mm-hmm.
I wasn't expecting to have this flare. And I call it a
Mm-hmm.
flare. Other people might say, oh, this is you detoxing. I
Mm-hmm.
call it a flare because my body didn't have what it needed to not have a flare, right?
Right.
So
Right.
it's a clue.
Mm-hmm.
Um, but that dysregulated my confidence, my
Mm-hmm.
thinking, my well-being. Am I ever going to get out of this flare? Like the
Mm-hmm.
spin that happens. And
Sure.
for me,
Yeah.
that's what I labeled it. I'll find different terms, but
Yeah.
I caught, not at that time, I had additional flares going on, but I'm like, oh, it took me down that BII spin flare,
Mm-hmm.
where
Mm-hmm.
that type of stress
Mm-hmm.
didn't allow me to rest and digest, right? So
Mm-hmm.
dealing with your mind
Mm-hmm.
and your perception and your context is
Mm-hmm.
so key to get through those detoxy flares, whatever you want to call them, right?
Absolutely. Oh my
Um,
gosh. Thank you for saying that. I hope my clients are listening to that because I say you have to have the mindset. You got to be ready. There'll be potholes. This is how I describe it. I'm like, we're driving up a hill. We're going to get to see the sunrise, but
yeah,
there's some big potholes along the way. And when you hit a pothole, you don't want to think your car's falling apart. You don't want to think this is the end of the road. We're never going to make it to the apex of this hill, you've got to really have your mind, prepared, good mindset around that. Mm-hmm.
yeah. And I think how I got through that was more like, what is this telling me?
Mm-hmm. Mm-hmm.
Where's the gap? Where's the hole I can fill with,
Mm-hmm.
whether it's lifestyle changes or nutrients, or,
Mm-hmm.
oh yeah, I didn't eat right this week, or I
Mm-hmm.
overdid it, or like I really,
Mm-hmm.
it teaches me, it's my Geiger counter, and it
Mm-hmm.
teaches me to look at life. Do I like
Mm-hmm.
looking at my life and having to change things? No. But it
No.
teaches me to do that. And then, maybe I need to cut out coffee, right?
Yeah.
Maybe I was drinking 3 cups a day or whatever it is,
Right.
right?
Right.
And
Mm-hmm.
yes, that happened.
Yeah, I know.
Or maybe, I needed to stop eating sugar, or, in the menopause part of the journey post explant, like 5, 6 years, um, my sugars became higher. So my insulin wasn't
Uh-huh.
working as well. So insulin resistance, right?
Mm-hmm. Mm-hmm.
That impacted my sleep
Mm-hmm.
and did some things. So, and I would have these little flares that reminded me of my BII days.
Mm-hmm.
And
Mm-hmm.
I'd get so pissy.
Mm-hmm.
And I had to really take inventory and really revamp how I eat,
Mm-hmm.
right? So when you have a decrease in estrogen due to menopause,
Mm-hmm.
sometimes your sugars, your insulin resistance go up, and sometimes
Yeah.
your cholesterol can go up too.
Right.
You know, and
Right.
that's just a thing. So we have to be agile. We have to have plasticity to shift, but your
Mm-hmm.
body's telling you something.
Yeah.
You know,
Exactly. That's a really good point because I think it's hard. We get so used to our lifestyles. I had a client one time ask, "What's the hardest thing your clients encounter?" She was asking before she started working with me. I said lifestyle new diet is the hardest thing, because get so comfortable in our patterns of life that it's hard to change.
Oh my
you
gosh,
know
there was a couple of hard things, but in this moment, you reminded me of when I realized I had to give up wine. And that
oh
was my
yeah.
coping mechanism, like a
Uh-huh.
glass of wine a night, come home,
Yep.
unwind, sit on the porch. Like I
Yep.
loved it.
I know.
And but my histamine and yeast overload would not budge when I would
Yep.
have the wine, right?
Yep.
And my sleep,
Ah,
and I did
ah,
everything I could to
yep.
do the thing to have the wine. As
Yeah,
soon
I
as I
know.
gave up the wine, I didn't have to do all those things, and life was so much freaking
Oh
easier.
my gosh, I'm so glad you mentioned the wine, because I was
Oh,
like, okay, I'll just drink vodka every now and then.
oh,
Still not the
yes, the
same.
tequila,
My
tequila.
Yeah, no.
No
Because
kidding.
I can't do the wine either, neither white nor red. So
Yeah.
yeah,
And so now when I like every now and then, like, so when you get to a point and you listen, like I had a glass of wine the other night. I didn't sleep as well,
yep,
right? And it's just like,
yep,
ah,
yeah,
and don't mess with my sleep.
yeah. I know. For goodness sake, that's the truth.
Yeah,
Well,
it's funny.
I think it's interesting. You posted a while back about the impact on, and maybe it was you, maybe it wasn't you. I thought it was your post about a study that came out about the impact that breast implants have on babies. Was that from you?
Oh, yeah. Well,
Okay.
I know. I don't know if that particular post was me,
Uh-huh.
but
Did you
yeah,
see
it
that
is.
study?
Yes.
Okay, so yeah, I just try to make a point that breast implant doesn't just affect women; it affects other things. When I was getting ready to have my breast implants, I had two children, and the reason I wanted them was because I went from no boobs to saggy boobs. like,
Yeah.
like I had, like, they were flat now pointing toward the ground, and I was like in my 20s. I was like, this is ridiculous. Like, I
And in
look
today's world, who wants to look natural?
yeah. So I went and I had the surgeon was like, yeah, if we do it under the muscle, it may support you structurally. Are you planning to have more children? I said, yes. He said, definitely, it would probably help you structurally to maintain as you nurse, as your milk comes in, comes back out. So I had three more children after implants. And I know that my last baby's liver was definitely affected from she's a mess. Like, she has a lot of things, histamine issues, yeast issues. Her liver was stressed when she was an infant. And now looking back, I know that it had to be because I was nursing from probably a ruptured implant at that point, to be honest.
Yeah.
But
Well, y- so it's funny. It's not funny. Like I find myself just breaking out in a hot flash right now because this topic is so needed,
mm-hmm,
and we don't have enough information on it,
mm-hmm,
right? And knowing, so if anything I say today, it's what I believe as a
mm-hmm,
truth from my own research and looking into things.
mm-hmm,
And there's
mm-hmm,
a lot of things that I've come to read and correlate,
mm-hmm.
right? When you look at
Correlation doesn't mean causation, and
exactly.
correlation doesn't mean that we've got studies in the true sense of double-blind, placebo-controlled, yada yada yada
Yeah, yeah,
studies.
yeah, yeah, yeah. Yeah.
Yeah.
But what I'm feeling real worldwide, and you take the information that also just came out about when a baby is born and you look at their blood or you look at the placenta blood, how many
Mm-hmm.
toxins are in
Oh,
that child
it's
already.
so outrageous.
And then we see the microplastic load there. So they've done
Yeah.
these testings, right? But
Yeah.
not necessarily. Actually, there'll be data coming out probably in 2025 on this specific,
Woo.
right? And so we have these toxic load
mm-hmm.
being passed from mom to the baby because the baby gets everything that the mom has. Like
Mm-hmm.
that's how it's supposed to be,
Mm-hmm.
right? And
Mm-hmm.
immune system function,
Mm-hmm.
that's how it's supposed to be. So imagine, right, that mom is in a cytokine storm,
Mm-hmm.
COVID, um, uh, Sorry, we have a little guest just at the window of my basement
Oh,
home, which is very, very funny.
oh,
I could
oh.
show people. What the heck?
Wait,
Let's do it. Let's see if it does it.
what
And
is?
just
It's
so
a
you
cow.
know,
Kitty, come
that's
here,
not
kitty.
mine, so it was a little distracting. Um, it was a good little break. Cytokines, right?
Hmm.
Inflammatory responses
You're right.
get, and if your immune system is in overdrive, if your
Hmm.
amygdala and your insula and your limbic system is overdrive and you're in a
Hmm.
hypervigilant state,
Hmm.
that's going to get passed or interpreted somehow to that little fetus in
Hmm.
utero, right?
Right.
It
Right.
it 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 just it rolls with it, if you will.
Hmm.
So it develops within these certain conditions that are within the mom. And
Hmm.
we are
Hmm.
now finding that breast implants cause certain conditions. And,
Hmm.
how do we mitigate that, right? So the
Hmm.
two big ones, and not the only ones, and we'll keep cancer over here, right?
Hmm.
But the inflammatory process happens, and we have endocrine disruption, which is
Hmm.
hormonal, which is,
Hmm.
you know, uh, endocrine immune, neuroimmune type of
Hmm.
things, right? And then you have a methylation disruption,
Hmm.
right?
Hmm. Hmm.
So you have a car that's not all working as fluidly, and
Hmm.
and and the baby still grows, which is
Hmm.
a wonderful thing,
It's a
right?
miracle.
So there's that, right?
Hmm.
And then there's the breastfeeding aspect.
Hmm.
When
Hmm.
you look at what gets transferred, the microplastic and
Hmm.
the whatever, like when you eat a piece of garlic,
Yeah.
it gets
Baby's all
passed to the baby,
gassy and bubbly and, we'll
right?
be pumping and dumping because we decided we're going to drink tonight, right?
Right,
So
exactly,
everything.
right?
Yeah. Yeah.
Same with drinking or all
Yeah.
this, right? When
Right.
you have two silicone bags that sit
Hmm.
here, I'll have a little caveat of another thing to put in the mix. Like
Hmm.
things get passed into that lymphatic system, and the
Hmm.
breast tissue is
A
fatty and
giant
lymphatically,
lymphatic. Yeah.
right?
A
So
giant,
it's
amazing lymphatic system.
so you see how I'm making like correlations and jumps, right?
Yeah.
What
Right.
we also know is that silicone is a great absorber of like oil spills and things, chemical
Yeah.
spills. It is a chemical sink hole
Wow.
for all things, including caffeine, you know.
Wow.
And so,
Wow.
what do we
Wow.
do with this information?
That's
So,
incredible.
it's in our body. We know we excrete it, we know we pass it. We've
Hmm.
looked at autopsies from women who've had ruptures, right? So,
Hmm.
again, another correlation, another jump,
Hmm.
and it's
Hmm.
in every part of the body,
Hmm.
right?
Hmm.
Why wouldn't it be in utero
Hmm.
facilitated? And why wouldn't it be through breast milk as well,
Right.
right?
Right.
Now, what we don't know is like breastfeeding is awesome for that
Hmm.
baby,
Hmm.
right? So, what we don't know enough of yet is what's better, breast milk with implants or formula.
Formula. That's the question. That's the $1 million question.
Well, I
Yeah.
think there's so much benefit in the breast milk.
I know. I know.
I wish there was a way to filter and do the thing. So
Yeah.
what I want to leave people more with empowerment and hope,
Hmm.
right? So if you're planning to get pregnant, let's talk.
Hmm.
Right? What does that look like head to
Right.
toe, right?
Right.
What other
Hmm.
implantable devices do you have? Do you have dental infections? Do you have amalgams and different things like that? Like,
Hmm.
how do you
Right.
get yourself ready? If you
Spinal
have breast
implants.
implants and you can't get pregnant, let's talk
Hmm.
about fertility and endocrine disruption there, right?
Right. That's huge.
If you've breastfed your kids with implants in, let's talk
Hmm.
about the best ways to optimize their health.
Right.
And we do what we do with the tools we have today.
That's right. That's
There's
what I
no
tell
room
people.
for like
There's
shoulda,
no
woulda, coulda.
shoulda, woulda, coulda. No, there's no. This isn't to create shame. There's no
Oh no.
shame in a having breast implants. There's no shame in having done the things you did because you thought they were okay at the time. You
Yep.
didn't know. You're responsible for the things that you know. If you're seeking to know more now, praise the Lord. But you're only responsible for what you know.
And it's a challenge. And you just heard
There's a
our
lot.
stories. Like, we go to physician to say, hey, is it this? And they say no. So the
Right,
whole world is learning
right,
with us, right?
right. Exactly. I love that. I think that's really important. And you've aptly named your program the Hope program,
Yeah.
your implant. So I'm gonna use that as a nice little dovetail or segue
Oh, yeah, yeah,
because
yeah.
because
So that stands for health optimization pre and post explant.
yeah, that's
And
beautiful.
that was like a sort of like, okay, this is the next step of what we need to do. And um, it's not a detox smoothie.
No, it's not a
You
detox
know,
smoothie.
it is addressing all the lifestyle shifts, right?
Right,
Because we now have a different load on our body, even if we've explanted, that
right.
we're going to need to deal with.
Kind of
And
unique. I mean, we all walk around this planet with a toxic burden.
yeah,
Everybody with or without implants. It's just a unique added problem because one of the things you said that was just so important is that your silicone now acts as a reservoir, like a sponge to suck up all these other things. So now you have the environmental toxic load that everyone is exposed to in their air, food, and water,
yeah,
and you have this mop that holds on to them. So as you go to detox, now we have this added problem of this
yeah.
sponge that's laden full. How do we get it out of there? You know?
And
Yeah.
silicone is slickery,
Mm-hmm.
right? It's not a binding type of uh, molecule, right?
Mm-hmm.
So unlike
Mm-hmm.
a positively charged metal,
Mm-hmm.
silicone, at least how we know it, it has varying charges, but it's not a
Mm-hmm.
strong positive charge.
Mm-hmm.
So
Mm-hmm.
binder, silicone binder.
Yeah,
You know what I
right,
mean?
right. It
Like
just
if this
goes
was a
right past it.
metal.
Yeah, exactly. Yeah, exactly. So you have to get a little bit more creative to kind of energetically creative.
Yeah, no, and there, well, that's why drainage pathways and flow,
So
right?
that's a
That's
great, I was
why,
very right in my question. What's your approach?
yeah,
Let's
yeah.
talk
Oh,
about it. Yeah.
sorry, I get to,
You,
like, opening drainage pathways, which means really supporting the lymphatics,
mm-hmm.
supporting even the
Kidney.
scars, and not just the scars of breast implants,
Yeah.
the emotional scars
All,
as well
yeah.
as physical.
Physical and emotional. Yeah, like I have 5 C-sections, 5 times cut through my abdomen. Like that's a scarring that affects the meridian flow of energy in the body, which affects how we heal.
Yeah.
And that's a physical scar. But then we also add in the scarring and the HPA
Any
axis from emotional stress and
any
trauma.
surgery, any cut into the body, any scrape, we have an emotion, a story tied to it, right?
Mm-hmm.
Not like
Mm-hmm.
bad. Some
Mm-hmm.
some are like happy, you know.
Mm-hmm. Mm-hmm.
Um,
Babies.
yeah, like when I was trying to surf and I fell underwater and I like scraped down the
Scratch.
bottom. That was actually fun.
It was fun, but it left a really nasty scar.
Yeah, exactly. No,
Yeah.
so flow, like any
Mhm.
place you have stagnation. And for
Mhm.
me, the big thing is the visceral, the gut, and the
Mhm.
lymph, right?
Mhm. Yeah.
Um, bringing less viscosity, less thickness to it, right? To
Mhm.
do that for lymph wise, you have to address the bile,
Right.
right? You have to
Mhm.
address digestion. You have
Yep.
to address assimilation,
Mhm.
right? And so, so we do that, and then that to me, mouth to anus is a drainage pathway, and anything in
Absolutely.
between. So
Mhm.
some of us, if this is just more of an illustration, not a factual thing.
Mhm.
Silicone can clog the pipes in your kitchen, and
Mhm.
it causes
Legitimately.
what?
Legitimately.
Yeah.
Like it will. Yeah.
So we need to keep all those pipes open. And
Mhm.
it's not that it's hard, and we call that drainage, right? If you were to
Mhm.
push a detox
Mhm.
and you're not going to the bathroom 2 to 3 times a day, you just
Mhm.
recycle it. If
That's
you're
right.
going to push in sauna and your methylations, your drainage pathways aren't open, you're going to
Mhm.
feel sicker,
Just simplistic terms is we liberate those toxins. When you detox, because that's such a buzzword,
Yeah.
you liberate those toxins from where they've maybe had nice storage. They become more reactive. They circulate around your body. And what happens is, we take antioxidants to reduce the oxidative damage that leads to aging and sickness and everything. But the oxidative damage happens because of free circulating toxins. So once we've taken those toxins out of storage and circulated them, now we've created all kinds of oxidative damage and stress, which leads to, if we want to get real just superficial, it increases our aging rate. Like let's just get, it makes us have more joint pain. It has obviously causes chronic
skin
disease.
laxity, especially
Yes,
with BII,
collagen gets broken down. Yeah,
that's a real thing.
Yeah, it is.
Um,
It's just kind of interesting because collagen is also used, in the face, to reduce aging. But then I guess we get this vicious cycle. They'll always need it because the destruction of the hyaluronic acid and everything under the skin.
I wasn't clear. Yeah. But what's interesting about a little fun fact? Many people with breast implants have an overload of yeast and mold and fungus, right?
Oh, yeah.
And so what does yeast put off? Hyaluronidase.
Oh, which breaks down your hyaluronic acid.
Exactly.
Oh my gosh, which makes you makes you age faster.
It makes you age faster, right? That yeast, fungus, mold, and that skin laxity.
Yeah.
But when you get the filler, this could be a whole other, please don't get the fillers.
Don't get the fillers.
But those that do, you'll see that, instead of every 6 months or whatever the N is, you're every 3 months because of what's going on in your body. Right?
Wow.
So
Wow. That's I just thought I had to tie that in because beauty matters. We want to be pretty and healthy, and if we can, it just does. It really undermines our confidence when we start aging rapidly. Yay, we have our implants, but our aging now increases and we have to do all this extra.
And
oh my gosh, the money we spend.
At 57, I feel like the skin laxity I have is appropriate versus inappropriate when I had the breast implants and healing from BII.
Right.
That extra, it's, I wish, I don't think I have any pictures of that, but it's lax skin. It was just everywhere. And that is not as present like that now. I feel appropriate. I feel age appropriate right now.
Age appropriate. You look great. I wouldn't have guessed 40 to 50. I was thinking you're still in your 40s. I really didn't know how old you were. So you look amazing. Your skin is good.
But so we really work on opening, drainage, digestion, lifestyle, really give you the tools so you can do this on your own and live life, right? There are some supplements involved if people can take them. There's some that have this mast cell thing that can't, right?
Right.
We still work the formula of opening, drainage, digestion, and assimilation, and making sure you're nutrient rich. So it's really a nourish and an open release kind of program, if you will.
Yeah.
And then
nourishment is that's a great term to use because I feel like that's what we miss. We miss nourishment. We eat, but do we nourish our bodies? I feel like that's what we don't do. We eat because we're hungry and we need to, because it's just a thing we do, but we don't get nourished.
Are you eating the things to give you what you need?
Correct. Right.
Are you nourishing your sleep patterns?
Right.
Are you still drinking that glass of wine before bed?
Right.
Yes. No.
I know. I choose that carefully. Is it worth it? I have the conversation in my head.
It's so funny, but
really
each
not
time
worth
I
it.
say yes, it ends up a no.
It was a big fat no the next day, wasn't it? Dang nabbit.
No matter how I biohack it for the next day.
Yeah. So true.
So that's the big cornerstone. And if in 3 to 4 months people aren't improving, then I know you have a concomitant issue like
Mm-hmm.
mold or Lyme or
Mm-hmm.
a different viral, parasites or like
Mm-hmm.
EBV or things,
Mm-hmm.
right?
Right.
And then that's when I will do testing.
Mm-hmm.
That said, we are doing a research study now on mycotoxins. So
Mm-hmm.
we do a serum mycotoxin test from
Mm-hmm.
mymycolab.com.
Mm-hmm.
And if you have implants, if you're going to do it, we need your data.
Mm-hmm.
And if you have explanted and you're still feeling ill, we need your
Mm-hmm.
data. So if you do
Mm-hmm.
this test, just email me or what have you.
Yeah.
And we're looking at serum antibodies, IgG and IgE.
Mm-hmm.
If you have mycotoxin antibodies,
Right.
then we know you have mold, right?
Mm-hmm.
What we don't know
Mm-hmm.
is that a past exposure or is that a right now
Mm-hmm.
exposure?
Mm-hmm.
It's
Mm-hmm.
real interesting. We have about 25 people now and that have explanted.
Mm-hmm.
They all came back positive
Yeah, I
for
just did a
antibodies.
mycotoxin urine test. It was interesting. I did testing on everyone in my home. Took out a small mortgage.
Right.
I say that because I did all the functional labs, and they're not cheap, no matter how you slice it. But it was very helpful to see that because I did my 18-year-old, my 13-year-old was the one with Lyme that I had to do all this work with. He was so sick. My 10-year-old and my 9-year-old, and then myself. And only two of us had mycotoxin issues. It was me and my 9-year-old.
Oh,
My
wow.
my 13-year-old, whose Lyme is resolved, his labs looked the best of everybody's. It was impressive. I was like,
Are
yes.
you still treating him?
Yeah, we're still doing some lymphatic work. He still has some lymphatic tissue that's congested, indicating he still needs a lot of drainage work. But overall, he's well. He's a pretty normal kid. But it was very interesting. The main toxins exposure, like the main toxins coming out, weren't heavy metals on me. They were. I had a toxin called oh gosh, something E. I can't remember, but it was a mycotoxin that's actually categorized as a biological weapon
Oh.
because it's considered
Was
so.
it T2? Was it
T
toxin
T2
T2?
T2 toxin. That's what it was.
Yeah.
T2 toxin. Yeah. So I was like, what in the world? Because it's
Why do I
so.
know that?
I thought that was random. How did you know that? It was really high on me, which I thought was really interesting. It's a mycotoxin, but it's so stable and it's hard to clear. That's why they categorize it as a bioweapon, which I think is interesting. But I thought that was helpful to see the whole family, because if the whole family had mold, then well, we maybe have an environmental problem. But given my history of breast implant illness, and then my son who had the mold, he's the kid that doesn't detox well.
Yeah, yeah.
He's like he had major impact from my implants. I think in utero is another one. He had growth restriction. He had things like that. So he has a lot of work still to do, but he looks healthy, he acts healthy, his brain's fine. It's just I know biologically he's still got some work to do. So it's
When
interesting.
the in August, I think the week of the 19th, we're having a BII recovery summit,
Perfect
right?
segue. It's my next
And one
question.
of the speakers there will be talking about the different ways to assess your home. And he has some
Good.
very reasonable approaches to
Okay.
assess.
Oh, good.
Um, and then if remediation is needed, that's a whole other conversation.
Right, right, right.
But you'll want to check that out. I don't know when he'll air. We're just recording now, but
So that was a great segue. I'm just going to go ahead and launch and ask you to tell us about the upcoming Breast Implant Illness Summit that's coming
yeah.
up.
So Sarah Felipe and I from Reversing Breast Implant Illness, we just literally we were on a Zoom call one day and said, you know what, we need to educate. We need to bring this education to everybody.
Mm-hmm.
And when I was doing the math to see what the impact of breast implants were
Mm-hmm.
2005 to 2022, over 32 million breast implant procedures, including augmentation and reconstruction, have been placed. If we conservatively say 30% of them will have systemic issues like breast implant illness or lymphoma or capsular contracture or things like that,
Mm-hmm.
that is over 9 million women. impact.
Holy cow.
So we have gathered well over 50 key opinion leaders of like who we listened to when we were ill, because Sarah had BII as
Mm-hmm.
as well as mentors and things. So they
Mm-hmm.
are the
I'm speaking.
the cream of the crop within their field, and so we're bringing that to everybody in August. So it'll be
Yeah.
free. I think you'll have to like go to Navwell RX to find out, or go to Sarah's site as well.
Mm-hmm. Mm-hmm.
Um, to find out when we're gonna launch the whole thing, but it'll be
Mm-hmm.
like free for that week.
Follow Danielle or I on our Instagram handles, Facebook handles, because there'll also be information coming out there reminding you of the summit coming up. So make sure
Yeah.
if you want to be getting access to that free, you definitely want to kind
Oh
of tune
yeah.
in. Yeah.
Please, like this is for people. So
Mm-hmm.
then it's going to be robust. Like
Mm-hmm.
no pun intended with the robust.
Ha ha
And
ha.
I promise I don't have that much humor. I don't talk much on the summit. It's mostly everybody else.
She does a
Um,
good job
but
interviewing.
yeah, so on Instagram, I'm just Navwell, Navwell. And
Mm-hmm.
another thing that's coming up in November is an academic symposium for professionals to learn
Mm-hmm.
about breast implant related issues.
Mm-hmm.
And this will be like really geeky. This will
Mm-hmm.
really be like, what do you do in your practice? How do you
Mm-hmm.
identify, let's look at capsular contracture. Like, how
Mm-hmm.
do you navigate your patient from A to Z? Right.
Right. So
And that will be
helpful.
20 practitioners presenting their clinical studies. So
Cool.
that's our third one doing that way. But they're totally different. The one in August is specifically for those wanting to learn more about BII, have questions about BII,
Mm-hmm.
and it's called
Mm-hmm.
the Breast Implant Illness
Summit.
Summit: Navigating Your Healing Journey
Mm-hmm.
2024. So
I'll put the link to that information in the show notes so you guys will be able to find that.
yeah. But
Yeah.
you'll be posting about it too. So
Oh, for sure.
if you
Yeah.
don't want to come follow
Yeah.
me, just follow her.
No, I think you gain a lot of value from following Danielle. She's got a different perspective on things. We didn't really dig into a lot of the unique strategies that you do. I know you are certified doing lymphatic work,
Oh
right? You
yeah,
do, yeah.
I do like osteopathic manual therapy, which includes lymphatic and
Mm-hmm,
visceral and nervous system reset and scar work as well.
mm-hmm,
I do that with my patients as a whole, so I tend to use that modality as my physical assessment, and it's been a wonderful journey using that
mm-hmm,
modality for people. So,
mm-hmm,
but I see a lot of people via telemedicine, so I
mm-hmm.
don't get to use that on them. I just
Yeah,
get to use the noggin and experience for that.
yeah. All right. Same. Well, listen, I really have had a good time. I really want to keep talking because I wanted to ask you about the saline versus the silicone. Man, we
Oh,
have so much to talk about, but
can
I
we give
know,
someone a teaser though?
yeah, we can because
Maybe
we'll
we'll
bring you
have
back in.
to. Yeah, and then I do have to run. Let's see if we can. So sometimes I get gifted things. And so here's a saline. I got to put another glove on.
So we have for our podcasters, I encourage you to tune in on YouTube, and the link is also going to be in your podcast show notes if you want to see what she's showing you. She's about to show you what an implant,
See, I don't think you
saline.
can see it
Which
here,
one is
but we'll
this
do
one?
it once this way. Oh, you can, but wait.
What in the world is that?
Can you see the snow
Yeah,
globe effect? Hold on.
the snow globe effect. Yeah. What is that?
I don't know. I mean, it could be any type of protein, any type of calcification. It could be a kind of
That's a saline implant.
mildew. Yes, this is a saline, and
So what you're seeing, for those of you not on the YouTube channel, you're seeing, like, it looks like she called it a snow globe effect because it really does look like flakes of those little white flakes you see in a snow globe. Like if you stirred it, it would just fall down, and it is
yeah.
circulating below
And this came out of a
inside the
patient.
implant. This is a
Yeah.
saline implant.
And this is the valve. I'll show you the other one real quick.
Yeah.
But you
So
see the discoloration. or
Yeah, so
browny black.
this is really important. As you put in saline implants, I believe I've seen this a couple times. Like they insert the capsule into the tissue, and then they'll often um, fill it with saline. So you get a flat capsule inserted, and then it gets filled with saline after it's placed in the body. So
And
there may be some contamination. I don't know, biological
well,
contamination.
it's a leaky area, right? So
Yeah,
this is
right.
her other implant,
Wow.
and look at the different color
Oh,
specks. I would consider,
wow.
we haven't tested it, but I would consider that mold, and this is a little bit more
Oh my
black, and it's
gosh.
on the inside, it's not on the outside.
Yeah, wow.
Now, I can hear everyone say, well, where has it been? How has it been stored since? No, there's no quality control since she just handed them to me in
Yeah, right.
our last visit. But they haven't really changed much in my visual.
Yeah.
And that's when you see her pictures from explant, they looked exactly the same way, right?
Isn't that amazing? It's
So
crazy.
maybe we can come on here and talk again.
Yeah, I would love that.
Maybe we can talk about more like mold and more
Yeah.
specifics to how, if you want to learn how to heal, literally listen to the summit in August. It's
Yeah.
right. We're recording in April
Yep.
now is,
Yep.
and so it's right around the corner, and that's going to be like
Loads of
I'm
information.
impressed with what we're accomplishing in a short
Yay.
amount of time.
I'm excited to see it. I really am.
Yeah.
But
So
that's a good teaser. So we will leave you on that because we should come back and talk about some of the differences between silicone versus saline because we have a lot of that question and just how it predisposes
oh
which
yeah.
ones
And how to
predispose
look
us
for
to
an
more.
explant doctor, and if they
Yes, and
tell
all
you
those
they want to
things.
deflate the saline
Yeah.
before you go to surgery, do you want the snow globe in you?
Yeah. There you go.
Even if it's easier for him, if it's easier for him or her,
Mm-hmm. Right.
maybe consider a different surgeon.
Right. So we still have a lot we want to cover, but we are limited by the time because yeah, everybody's going to probably listen to us in segments, but I want to get it all in a good podcast. So at that, I'm leaving you with a thank you, Danielle, for coming on the Rethink It podcast so that we can just talk about this really important subject. This is a really widespread stretching topic. I feel like more people are becoming aware, but it still has a long way to go. And I definitely want women to be empowered in this, to make choices that are in their power, right? Like that they are informed. We want informed consent. If you choose to do it after you've done all your research, it's okay.
Yeah.
But we want you to have the tools. I don't want you to go in blind and be sideswiped the way Danielle and I were. We want you to be empowered.
Yeah.
Do you have anything else you want to leave
No,
people
thank
with?
you for being you and spreading awareness, because this is near and dear to my heart, and I love enriching this population. So
Yeah. Yeah. It's about women's health. It's a
yeah.
really important topic. All right. Well, we'll talk next time. Looking
Okay.
forward to
Thank
it.
you.
Okay. Till then, bye.
Bye. I really gotta go.
So, what do you guys think? Was that a good conversation or what? Obviously, I am tickled to share that conversation with you guys. I hope that it really did feel, even if you don't have breast implants, if you don't this isn't even a conversation around implants for you because you don't, this isn't, it's not relevant to you. I hope you took some pearls away from it because a lot of what we talked about can be, relevant even to those not suffering necessarily from a breast implant. Maybe you have scar tissues. Maybe you didn't know about your methylation pathways. Maybe you didn't know about, the toxic burden that we can pass on generationally to our children. I hope you took a lot from this podcast. So thank you for joining me for another Rethink It podcast episode. I really do hope it was a blessing. If you did like this content, of course, here on the YouTube channel, like, share, follow, and all the things. We just really got to get the algorithm to recognize us. I'm just a baby YouTuber. I'm not really hoping to be anything outrageously popular, but I do want to make sure this content does get out to the people who needs it. So just do me a favor and like, share, and comment. And for the podcasters, the same goes for that. Just keep on following along. Make sure that you are subscribed to the channel so that you're the first one to see when new content loads. And I want to leave you with hope. Don't forget, there is always hope for lasting healing.